Nearly half of all adults in New Zealand are putting off going to the dentist because they simply can't afford it, and Māori and Pacifica communities are being hit the hardest. That's according to a new report out this morning from advocacy group Dental for All. The report looks at how 8 countries, including Japan, Canada and even Niue, fund dental care through their public health systems. So what can we learn from those models, and could they even work here? Joining us now to chat about this is Kayli Taylor from Dental for All, along with oral health therapist and academic Samuel Carrington. Good morning to you both. Thanks for coming on our show so early. Kayli, we'll start off with you. Really fascinating report. Why did you look overseas for your study here?
Thank you so much for having me. We looked overseas because we wanted to see how places overseas were doing dental care. We know that the state of oral health in Aotearoa is pretty dire. You said it yourself. And so as part of our campaign for free, universal, te tiriti consistent dental care, we wanted to understand what other countries were doing so that we could learn some bits and pieces from each of them and improve our own system here.
And so what stood out to you the most in this comparison exercise?
It was really interesting. I think each country that we speak about in the report has something specific that we can learn from it. I'm interested in Niue, for example. They have free dental care, obviously a very small country, but they made a decision that they were going to invest in oral health care, invest in what worked for their communities, and they've done that. And I think that that speaks to me about the potential for this to be something that we don't need to be afraid of. We don't need to kind of feel like it's too hard, put it in the too hard basket forever. We have been for some time, but I think with a little bit of imagination and a little bit of political will, we can make the change that we need to see.
And what about the comparisons with Canada and Japan? Obviously, you know, much bigger population, much more tax take there. Don't they just have more money to spend?
They do. I'm not sure exactly, you know, Canada and Japan's exact financial situations. But I think this kind of speaks to a report that we did a couple of years ago, which found that we're actually spending more as a nation to not have free dental care in terms of sick days, lost productivity, the costs on the rest of the health system. So it's actually not making fiscal sense to keep oral health care locked out of the public health system.
Yeah, so we're actually just paying for it on the other side of things. The problem is political will here, would you say? I mean, Labor campaigned on free dental care for under 18s at the last election. It obviously didn't get enough traction. How would you say we need to kind of turn the tide on it?
I think there's lots of different ways. I think some of the work that Dental for All, not to toot our own horn, but some of the work that we've been doing in terms of gathering stories of people's experiences and also those kind of fiscal arguments and making the case for policy change will help. I think there's also an element of people power here. The Dental for All campaign went on a roadshow last year and we spoke to thousands of people across the nation who had been kind of thinking about oral health and dental care for the first time in quite a while. And I think it's kind of up to all of us to agitate and to say, hey, this is something that really matters to us, especially as we look to the election later this year.
Wonderful. I want to bring in Samuel Carrington here, oral health therapist, also an academic at Otago University as well. You are clearly on the front lines. I mean, even right now. What are you seeing here?
Morena Ali, thanks for having me. Regularly I see adults in their 30s and 40s who haven't had checkups in, 4, 5, 10 years because they simply couldn't afford it. So by the time they come in, what might have been a simple filling has progressed to needing to be, something further like a root canal extraction.
So you presumably would be hugely supportive of publicly funded dental care?
Absolutely. I think if we think back to policy, we haven't had a policy around universal dental care since probably 2006. At that time, we reoriented the school dental service into the community oral health service. And that policy was actually called Good Oral Health for All for Life. The key part here being for life. So adults have just been left out of that. And we definitely need to reform the system.
Because what is the current model? So is it funded just throughout the sort of childhood till you're 15, presumably?
You're partly correct. So when you're born till you're about year 8, you go to the community oral health service, which used to be, the old dental nurses. Yeah. And then from college years, you're in what we call the combined dental agreement. So that's mostly done via private practices. And so dentists have to have that contract, or dental practices have to have that contract with the government.
And then is there basically just a sudden drop-off?
Correct. So once you turn 18, that's it. You've got to pay for it. We do have emergency wins grants that are available, and there's a $1,000 grant that people can apply for now, which has come in the last few years, which is better than what used to be the $300. But we're still an extractive kind of business at the moment. It's still bottom of the cliff kind of stuff.
What sort of what difference does sort of preventive dental care make, like you might see in the models in Canada?
A huge difference. If we can kind of instill those good oral health behaviours early on in life, and if we can have a system where people can come in every year for a checkup, ultimately that will cost the country less compared to if it needs to be a root canal or an extraction further down the line.
How much is the bill really if we provide universal dental care for life?
That's hard. And I'll go back to what Kayli said. It's costing us more if we don't do something. So I think the report that Dental for All came out with was it's costing the country $2.5 billion versus about $2 billion.
So what's your message to government, to policymakers?
I think every political party should have oral health on their manifesto this year. I know as a profession, we were really excited at the last election that we had the Green Party and the Labour Party putting oral health on the map. That's never happened in my lifetime. But I think all political parties should have, some form of oral health on their party's manifesto coming into the election this year.
All right, well, we'll stay across this issue. We appreciate you coming on our show this morning. Samuel Carrington, the oral health specialist, and down the line, Kayli Taylor as well. Thanks to you both.
Ngā mihi.